Everyone at home has heard of like flattening the curve. That's really important. We haven't got there yet.
All the talk in recent days has been how we stop the exposure to the coronavirus. Brandon Clement and Logan Poole are meteorologists using their experience in weather and emergency management to help. While plotting the spread of early COVID-19 cases on a map,
if you just said, okay, everything's being driven entirely by travel, entirely by population density, then the map of spread should roughly equate exactly to the population and travel maps, and it doesn't. So there's some modulating factors.
The duo just released a study in which they built a model that integrates sociological data like travel routes and population density with climate data, including temperature and UV index.
When we combined the three elements, it just got really accurate.
This is the coronavirus risk map forecast they released on February 26th. Now overlaid is a black dot for each case of COVID-19. Notice the clusters in New York City and Boston?
It felt amazing to see that verification.
The researchers theorized that the sun angle, and more specifically the UV index of a given spot, can be used to show areas at higher risk for future spread, especially areas without social distancing being practiced. When weighing the factor of the UV index versus other factors, however,
it's also important to recognize that we are talking about a modulating effect, not a primary driver.
The two caution that the map shouldn't be used to deem an area safe.
It maybe give us a guide of where increasing effort may need to be with time, as opposed to being able to draw down. Because until we see those caseloads drop, we're really not going to be able to pull back on the throttle at all.
My ultimate goal is to use this information inside of some machine learning viral modeling in order to prevent, if we know where it's going to go next, we can prepare those places next. It doesn't have to be 100%, but if we can get a statistical advantage to get ahead of the virus,